Nathan here from EHAS Inc. Mental health is a complex tapestry woven from biological, environmental, and psychological threads. While genes lay the groundwork and experiences shape our world, it is the realm of our thoughts, feelings, and behaviors that holds immense power. Understanding these psychological factors is essential to unraveling the mysteries of the mind and promoting well-being. Just as a gardener tends to the soil to cultivate healthy plants, understanding our inner landscape is crucial for cultivating a healthy mind. This exploration delves into the key psychological factors that influence mental health. We will examine how personality traits, thought patterns, emotional regulation, stress responses, and interpersonal relationships all contribute to our mental well-being. Each individual possesses a unique constellation of personality traits, enduring patterns of thinking, feeling, and behaving. These traits significantly influence our mental health. For instance, individuals high in neuroticism, characterized by a tendency towards negative emotions like anxiety and worry, may be more susceptible to experiencing mental health challenges such as anxiety disorders or depression. On the other hand, individuals high in conscientiousness, marked by organization and responsibility, often demonstrate greater resilience and better coping mechanisms in the face of stress. Extroversion and introversion, determining our energy levels in social situations, also play a role. While extroverts thrive in social settings, introverts may find solace and recharge in quieter environments. Understanding our personality traits provides valuable insights into our strengths and vulnerabilities, allowing for personalized approaches to mental well-being. Our thoughts have immense power over our emotions and behaviors. Cognitive patterns, the habitual ways in which we interpret and process information, play a significant role in shaping our mental health. Negative thinking patterns such as catastrophizing, assuming the worst-case scenario, overgeneralizing, drawing broad conclusions from isolated incidents, or black and white thinking, seeing things in extremes, can contribute to anxiety, depression, and low self-esteem. Conversely, cultivating positive and realistic thought patterns can have a profound impact on our mental well-being. Cognitive reframing, challenging negative thoughts, and replacing them with more balanced perspectives is a valuable tool for improving mental health. By becoming aware of our thought patterns and actively challenging unhelpful ones, we can shift our inner dialogue towards greater positivity and resilience. Emotions are an integral part of the human experience, providing valuable information about ourselves and our environment. Emotional regulation refers to our ability to manage and respond to emotions effectively. Individuals with strong emotional regulation skills can navigate challenging emotions without being overwhelmed, allowing them to maintain emotional balance and make sound decisions. Conversely, difficulties with emotional regulation can contribute to various mental health challenges. For instance, individuals who struggle with managing anger may be at increased risk for aggressive behaviors, while those who suppress their emotions may experience physical health problems or difficulty maintaining healthy relationships. Developing healthy emotional regulation skills, such as identifying and labeling emotions, practicing mindfulness, and seeking support when needed, is essential for promoting mental well-being. Section 5. Stress pressure cooker or catalyst. Stress is an inevitable part of life, arising from various sources such as work, relationships, and major life events. While short-term stress can be motivating, chronic or overwhelming stress can have detrimental effects on our mental and physical health. Our coping mechanisms, the strategies we employ to manage stress, play a crucial role in determining our resilience. Adaptive coping mechanisms such as exercise, relaxation techniques, and seeking social support can help mitigate the negative effects of stress. However, maladaptive coping mechanisms such as substance abuse, social withdrawal, or avoidance can exacerbate mental health challenges. Developing healthy coping strategies and seeking professional help when needed are essential for navigating life's stresses and maintaining mental well-being. Section 6. Scars of the past, trauma and its echoes. Traumatic experiences such as physical or emotional abuse, neglect, or witnessing violence can have a profound and lasting impact on mental health. Trauma can manifest in various ways, including flashbacks, nightmares, anxiety, depression, and difficulty trusting others. Adverse childhood experiences, such as growing up in a household with substance abuse or domestic violence, can have a particularly significant impact on long-term mental and physical health. Understanding the effects of trauma is essential for providing appropriate support and intervention. Trauma-informed care recognizes the pervasive impact of trauma and seeks to create a safe and supportive environment for healing. Therapies such as eye movement desensitization and reprocessing and trauma-focused cognitive behavioral therapy have proven effective in addressing the effects of trauma and promoting recovery. Section 7. Bonds that bind. Attachment and relationships. Our early attachment experiences, the bonds we form with our primary caregivers in infancy and childhood, shape our expectations and patterns in relationships throughout life. Secure attachment, characterized by trust, emotional closeness, and responsiveness, provides a solid foundation for healthy relationships. However, insecure attachment styles, such as anxious, avoidant, or disorganized, can lead to difficulties in forming and maintaining healthy relationships. Interpersonal relationships play a vital role in our mental well-being. Strong social connections provide support, reduce stress, and contribute to a sense of belonging. Conversely, social isolation and unhealthy relationships can contribute to loneliness, depression, and anxiety. Developing healthy communication skills, setting boundaries, and nurturing supportive relationships are essential for maintaining good mental health. Section 8. The self in the mirror, esteem and concept. Self-esteem refers to our overall sense of worthiness and value, while self-concept encompasses our beliefs and perceptions about ourselves. A positive self-image, characterized by self-acceptance and confidence, is a cornerstone of good mental health. Conversely, low self-esteem can lead to self-criticism, negative self-talk, and difficulty asserting oneself. Building self-esteem involves challenging negative self-beliefs, identifying and appreciating our strengths, and practicing self-compassion. Engaging in activities that align with our values and passions can also boost our sense of self-worth. Furthermore, surrounding ourselves with supportive and encouraging individuals can help foster a more positive self-image. Section 9. Learning our responses, conditioning and behavior. Cognitive behavioral therapy, or CBT, emphasizes the interconnectedness of our thoughts, feelings, and behaviors. This approach posits that our thoughts influence our emotions, which in turn influence our behaviors. Conditioning, a fundamental principle in CBT, explains how we learn to associate certain stimuli with specific responses. For instance, if we experience a panic attack in a crowded place, we may develop anxiety about being in similar situations in the future. CBT techniques such as exposure therapy, gradually confronting feared situations, cognitive restructuring, challenging negative thoughts, and behavioral activation, engaging in pleasurable activities, can effectively address various mental health challenges by modifying unhelpful thought patterns and behaviors. By understanding the principles of conditioning and reinforcement, we can gain greater control over our responses and break free from negative cycles. Section 10. The price of perfection, striving, and its shadow. Perfectionism, characterized by striving for flawlessness and setting unrealistically high standards, can significantly impact mental health. While often perceived as a positive trait, perfectionism can lead to chronic stress, anxiety, and fear of failure. Individuals struggling with perfectionism may experience procrastination, self-criticism, and difficulty experiencing satisfaction or accomplishment. Addressing perfectionism involves challenging rigid beliefs about success and failure, setting realistic expectations, and practicing self-compassion. Therapy can provide a safe and supportive environment to explore the underlying causes of perfectionism and develop healthier coping mechanisms. Learning to embrace imperfection and focus on progress over perfection is crucial for reducing stress and improving overall well-being. Section 11. Identities, tapestry, comparison and belonging. Our sense of identity, who we are and where we fit in the world, plays a crucial role in our mental health. Social comparison, evaluating ourselves in relation to others, is a natural human tendency. However, excessive or upward social comparison, constantly comparing ourselves to those we perceive as superior, can lead to feelings of inadequacy, envy, and low self-esteem. Developing a strong and secure sense of self involves focusing on our own values, strengths, and accomplishments rather than constantly comparing ourselves to others. Cultivating a growth mindset, believing that our abilities and intelligence can be developed through effort and learning, can foster a more positive self-image and reduce the negative impact of social comparison. Section 12. Unconscious currents, psychodynamic influences. Psychodynamic theory, pioneered by Sigmund Freud, emphasizes the role of unconscious processes, early childhood experiences, and unresolved conflicts in shaping our thoughts, feelings, and behaviors. Defense mechanisms, unconscious strategies we employ to protect ourselves from anxiety or emotional pain, can influence our relationships and coping mechanisms. Psychodynamic therapy aims to bring unconscious conflicts and patterns into conscious awareness, allowing individuals to gain insight into their behaviors and make positive changes. Exploring early childhood experiences, understanding defense mechanisms, and developing healthier coping strategies are key aspects of this approach. While not a quick fix, psychodynamic therapy can provide valuable insights and promote long-term emotional healing. Section 13. Understanding for healing. Insights into action. Understanding the intricate interplay of psychological factors in shaping mental health is crucial for promoting well-being and addressing mental health challenges. By recognizing the influence of personality traits, cognitive patterns, emotional regulation, stress responses, interpersonal relationships, and past experiences, we can gain valuable insights into our own mental health and that of others. This understanding allows for early identification of potential risk factors, development of personalized interventions, and promotion of resilience. Whether through therapy, self-help strategies, or simply increasing awareness, applying this knowledge empowers us to cultivate healthier minds, navigate life's challenges with greater resilience, and foster a more compassionate and supportive society. Mental health is a journey, not a destination, and understanding these psychological factors provides a roadmap for navigating the complexities of the mind and promoting lasting well-being.